Good morning. Myself, Dr. Sanotsh Dora. Today, I'll be discussing one of the common topic, that is the vaginal discharge. So, I'll be covering this topic under the following headings. First of all, I like to discuss regarding the natural defense system of the pelvis, then the causative organisms, then subsequently mode of transmission, clinical features, investigations, and management will be discussed. So, coming to the natural defense system of the pelvis. So, basically, the skin of the vulva and vagina is covered by the squamous epithelium, and of course, these are resistant to infection. So, as in case of cervix, a mucus plug is present in the endocervical canal, and this endocervical canal, because of harboring the mucus plug, prevents any infections that is present in the vulva or vagina to the ascending into the uterus or fallopian tube. In case of uterus, you see there is periodic shedding of the endometrial tissue during the menstrual cycle. So any infection that is residing inside the uterine cavity will be automatically shedded out from the uterine cavity during the menstruation. And the ostia are naturally closed. So any infection that is present in the uterine cavity also prevents by your, going ascending into the fallopian tube and ovary and peritoneal cavity due to the closure of the ostia. And besides this, you see the vagina is colonized by dorsal bacilli. Each dorsal bacilli secretes lactic acids and makes the environment acidic. This acidification prevents any pathogenic bacteria to grow inside the vaginal cavity, and of course, it also, prevents any kinds of, infection that is present in the vagina and vulva to ascend upwards. Then coming to the different causative organisms. The causative organisms can categorically divide into four categories. First, it is bacterial, it can be fungal, it can be parasitic, or it can be viral. So bacterial infections, mostly it can be either gram-positive or gram-negative bacteria, anaerobic bacteria, and most commonly the Neisseria gonorrhoeae, Chlamydia trachomatis are the commonest bacterial organism. And fungal infection, if you consider, then the first name comes is the Candida albicans. In case of parasitic infections, the commonest organism that is the Trichomonasis. In case of viral, the commonest organisms are particularly HPV infections and HIV. So these all infections particularly causes your vaginal discharge. Coming to the mode of transmission. This mode of transmissions can be either direct or contiguous spread. It can be through lymphatics, it can be through hematogenous spread, or it can comes from the adjacent organ, that is from outside the, your genital tract, from like acute appendicitis or appendicular perforation can also transmit infection to the pelvic organs, to the fallopian tube, uterus, like that. So first we discuss regarding the direct or contiguous spread. Particularly the Neisseria gonorrhoeae spreads by direct or contiguous spread. But in case of post-abortal sepsis or puerperal sepsis, the infection spreads through lymphatics, and particularly your tubercular bacilli spreads through hematogenous route. So we'll discuss three important vaginal discharge, that is the bacterial vaginosis, trichomonasis, and vulvovaginal candidiasis. So coming first, the bacterial vaginosis. So what do you mean by bacterial vaginosis? So basically it is a polymicrobial clinical syndrome where the replacement of a normal hydrogen peroxide producing lactic acid bacillus species by anaerobic bacteria. Then we'll call it as bacterial vaginosis. The symptoms are particularly, these patients may be asymptomatic, and when they presented to you, the most common symptoms are vaginal discharge, that is malodorous, thin, white discharge. And particularly, these discharges are fishy vaginal odor, and it can be observed following coitus. And when it is associated during pregnancy, it may cause preterm birth, PPRM, postpartum, and postoperative infection. So, how to diagnose such patients? For them, the criteria is called MCELS criteria. So, it has got 4 criteria, and out of 4, any 3 is present, then we will say that the patients might be having bacterial vaginosis. So, coming to the first criteria, these patients are having homogeneous thin white discharge that smoothly coats the vaginal wall. Presence of a clue cells. So clue cells are basically vaginal epithelial cells that are studded with cocobacilli, and it can be seen under the microscopic examination. And if you see the vaginal pH, then the pH will be more than 4.5, and a fishy odor that can be observed before or after the application of 10% potassium hydroxide, then this fishy odor you can observe. So this test is also called as whip test. So out of these four, if any three tests are present or any three characteristics are present, then we call these patients as a case of vector vaginosis. So how to treat such patient? So treatments are very, simple. So we can either give metronidazole or clindamycin. This metronidazole can be given either in tablet form or in gel form. So when you give it in tablet form, it will be given like 500 milligram twice a day for 7 days, and in gel form, it is been applied through an applicator, and it will be given for 5 days period. In clindamycins, also applied through an applicator intravaginally, and it will be given for a period of 7 days. Then coming to the next infection, that is trichomoniasis. So trichomoniasis patients are mostly asymptomatic, and when they are symptomatic, they mostly presented to us as a malodorous yellow-green with or without vulval irritations. And when it is associated with pregnancy, the complications like preterm labor, PPR, and post cesarean sepsis is the most common symptoms they present. And these patients are particularly also infect to their partner. So during the treatment, we have to treat also the sexual partner of the woman. So coming to the diagnosis and investigation, these patients are having profuse purulent malodorous vaginal discharge that may be accompanied by vulval pruritus, and this actually different from your bacterial vaginosis. In bacterial vaginosis, you see the discharge is very thin and small in quantity, but here the discharge is actually profuse. So this is the basic difference between a trichomoniasis discharge from the bacterial vaginosis discharge. And the clue cells, the vaginal pH are, of course, helps in the diagnosis of the trichomoniasis. The difference between the pH here is that the pH is more than 4.5, and normal vaginal pH is less than 4.5. And the whip test, which was there in bacterial vaginosis, also it can be seen in trichomoniasis. And in your clinical examination, you find a strawberry cervix that will also help in the diagnosis of the patients. So now coming to the management. The management wise, you can give metronidazole is the drug of choice. It can be given as a single dose, that is 2 gram, or you can give it as a multi-dose, that is 500 milligram twice a day for 7 days. So those patients who do not respond to a single dose therapy, then we can go for a 7 days therapy. Besides this, metronidazole, tinidazole can also be given in few patients. Now coming to the vulvovaginal candidiasis. These vulvovaginal candidiasis patients mostly, in fact, the ladies or the women, most commonly they at least experience one episode in their lifetime. And the commonest organism here is the Candida albicans. The women commonly presented to the OPD as a case of pruritus, vaginal soreness, and dyspareunia. Besides this, external dysuria and abnormal vaginal discharge is also can be seen. It can be the candidiasis can be either uncomplicated or complicated. Now coming to the diagnosis and investigations. The vaginal discharge, particularly watery to thick, and the characteristic signs of candidal vaginal discharge is that presence of cottage cheese appearance. This cottage cheese appearance is criteria, one of the most important criteria for the diagnosis of candidal infection. Besides this, you will see the patients presented to us as pruritus, and here the vaginal pH is normal. But in case of the last two, that is in case of bacterial vaginosis and trichomoniasis, the vaginal pH was more than 4.5. So this is the basic difference between these all three. And when you take this discharge under the microscope, you'll find there is presence of fungal elements. And in case of difficulty in the diagnosis, you can take the help of culture for the final diagnosis of the candidal infections. The management of the uncomplicated vaginal vulvovaginal candidiasis and the complicated vaginal candidiasis will be discussed. So first coming to the uncomplicated vulvovaginal candidiasis. So here will be clotrimazole will be the is the drug of choice. It can be given as a 1% cream or it can be given as a 2% cream. So in case of 1% cream, it has to be used for 7 to 14 days, but in case of 2% cream, it has to be used for 3 days. Beside this, the miconazole 100 mg or 200 mg can also be used, and the fluconazole 150 mg single dose also helps in the treatment of the uncomplicated vulvovaginal candidiasis. Now, coming to the recurrent vulvovaginal candidiasis or complicated vulvovaginal candidiasis. So, when you find a woman is suffering 4 times or more episodes of candidiasis in a single year, then we will call it a case of recurrent vulvovaginal candidiasis. So, in these patients, the diagnoses are more or less same as uncomplicated one, except these patients are more prone to develop candidiasis in a single year. So in these patients, you see the fluconazole either 100 mg, 150 mg or 200 mg can be used on day 1, day 4 and day 7. And in cases where you find that increased chances of recurrence, this same oral fluconazole can be given weekly for next 6 months to prevent any recurrence. So coming to the take-home message, any patients those presented to us with fishy odor smell with minimal amount of discharge, our fast differential diagnosis will be bacterial vaginosis. When same patients with to us with copious amount of discharge, then our fast differential diagnosis will be trichomoniasis, and presence of cottage cheese discharge with itching, then candidiasis will be the fast differential diagnosis. Thank you.